Montefiore Medical Center's infectious disease physician, Dr. Teresa Madeline, weighed in on the coronavirus outbreak in China as the death toll there continues to rise to an estimated 500, with close to 24,000 infected, with 12 cases confirmed by the Center for Disease Control here in the U.S., with the latest in Wisconsin. In New York City, officials are waiting for the results of 2 suspected cases, while a third was ruled out.
Coronavirus is a family of viruses, and more often it causes things like the common cold. But the novel 2019 coronavirus is sort of a new strain of coronavirus that was first reported in China and has caused an outbreak in that area.
Wuhan, China, to be exact, a world away from the 5 boroughs, yet the World Health Organization's Emergency Committee declared it constitutes a global health emergency and called on countries to take steps to contain it. Dr. Madeline breaks it down to what that means for New Yorkers.
The most important thing that people in the Bronx and in New York can do right now really is basic infection control measures, and that means washing your hands, covering your mouth and your nose if you're coughing or sneezing, stay home from work or school if you don't feel well, and to get your flu shot. The seasonal influenza right now is a much bigger problem, and people can protect themselves by getting the flu shot.
Initially, samples from patients suspected of carrying the virus were sent to the Center for Disease Control based in Atlanta, but now state health labs were approved to test in order to speed up efforts to detect the virus here in the U.S.
The concern is making sure that this virus doesn't spread further than it has, and to be sure that everyone is sort of prepared to identify patients and to treat them properly should we get patients.
The city is asking those who have traveled to China and are experiencing flu-like symptoms to be on the alert.
It can be spread most often through respiratory secretions. That means coughing, sneezing, or touching the respiratory secretions of an infected person.
While New Yorkers and Bronxites are safe, she adds that this hospital is equipped to handle anyone exposed to the virus. For BronxNet, this is Arlene Makoko.